Hi, my name is Devin Ritchie, and I am an LPN to BSN student at Indiana State University. And today I'm going to give you a presentation about influenza and pregnancy. So, first, let's talk about the learning objectives. So, you, as the learner, after viewing this presentation, will be able to understand the facts about influenza or the flu, understand the most common influenza symptoms, understand the risks during pregnancy related to the flu, understand how the flu is treated, understand how to protect yourself from the flu during pregnancy, and understand the facts about the flu vaccination. So at this point, I'm going to ask that you pause the video and please take the 10-question pretest that's linked in the description box below. Once you are done with that pretest, go ahead and head on back here to the video. So let's talk about some facts about the flu. So first of all, the flu is caused by a virus, not a bacteria, which is why the flu cannot be treated with antibiotics, which we'll talk later about treatment for the flu, but just know that antibiotics do not help with the flu at all. Also, the flu is contagious, so you can become contagious one day before you even start to feel sick, and you stay contagious for about 5 to 7 days after your first day of illness. And the flu is spread by droplets, which are made whenever people cough or sneeze or talk, which is why it's really, really important to cover your mouth if you sneeze or you cough. The flu is a respiratory illness, and the flu can be very, very mild or it can be very, very severe. And it's most common during the fall and the winter months. And the flu causes up to 61,000 deaths per year. So, what are some symptoms in the flu? So the flu can cause a fever, which is considered 100.4 degrees Fahrenheit temperature or higher, a cough, sore throat, runny or stuffy nose, body aches, headaches, feeling tired or fatigued, and vomiting and diarrhea. And vomiting and diarrhea is more common in children than it is in adults. So if you are pregnant and you have any of these symptoms, you should call your doctor right away. Next, let's talk about the risks during pregnancy with the flu. So, if you are pregnant and you get the flu, it's more likely to be severe. So, how we had talked about previously that the flu can either be mild or severe, in pregnancy, it's more likely to be severe, which means that you're more likely to be hospitalized with the flu. The fever that's caused by the flu can also cause neural tube defects in your developing baby. So, if you have any of these, you should seek immediate medical assistance. If you have a hard time breathing, pain in your chest or stomach, dizziness, seizures, not able to pee, severe muscle pains, severe weakness, severe cough or fever that improves and then returns or worsens, high fever that doesn't go away with Tylenol or a generic equivalent, and a decreased movement of your baby. So let's talk about influenza treatment during pregnancy. So the first treatment is an antiviral medication, which most people are familiar with the medication name Tamiflu. And Tamiflu is best when it's started within 2 days or 48 hours of the start of symptoms. So this is why it's really, really important that as soon as you start to feel sick or think that you have the flu, you call your doctor right away. Because the sooner that they can test you, the sooner they can get you started on the medication, which means that it's going to work better. So Tamiflu doesn't make the flu go away, but it can make the flu milder or it can make the flu last a shorter time period. So like I said, if you start to feel sick, call your doctor right away so they can get that medication started as soon as possible. If you have a fever, you should treat your fever with Tylenol or a generic brand equivalent, so acetaminophen. And remember, in pregnancy, you never want to take ibuprofen. So again, if you have a fever, treat your fever with Tylenol. You should also drink lots and lots and lots of fluids, and you should try to rest as much as possible. And then lastly, because you are contagious, you want to try to stay away from others. And remember, you can be contagious before you even start to feel sick, but as soon as you do start to feel sick or you get that positive result and are told that you have the flu, try your best to stay away from others. And I know this can be hard if you have a family or younger children that you're caring for, but just do your best to stay away from others because you don't want to spread the flu to other people. So, if you're pregnant, how can you protect yourself against the flu? So, first and foremost, get your flu shot. And the flu shot has to be given every single year. So, just because you got it last year doesn't mean that you're protected from the flu again this year. You have to get it every single year. Also, wash your hands. Wash your hands all the time and keep your hands away from your face, from your mouth. And whenever you touch anything out in public, just wash your hands or use a hand sanitizer. Also, cover your mouth. So if you sneeze or if you cough, use your elbow to sneeze into or to cough into, or use a tissue and then throw it away. Don't use your hands to cover your mouth if you have to cough or sneeze. Also, try to avoid people who are sick. And again, I know this can be hard if you have a family or you have younger ones that you're taking care of, but if possible, if you know someone is sick, try to avoid them so you don't put yourself at risk as well. So, lastly, let's talk a little bit about the flu vaccine. So, like I said before, the flu vaccine is the first step in preventing the flu. And again, it's one that you have to get every single year. It's not like other vaccines where it can last for years and years and years. You have to get your flu vaccine every single year. The flu vaccine is safe. So, in the largest and most recently published study, it showed that there was no increased risk of miscarriage. And the flu vaccine is still, it's recommended by the CDC or the Centers for Disease Control and Prevention, and it's recommended by the American College of Obstetrics and Gynecology, or ACOG, which is like the governing body that tells obstetricians and gynecologists how to practice medicine in their fields. And there is still ongoing monitoring constantly from the CDC and the FDA with the influenza vaccine to ensure that it's safe for patients to take. There are some side effects that are noted with the flu vaccine, and not everyone has side effects, but these are just some that you could have. So you could have some soreness at the site wherever you got the injection, some fainting, headache, fever, muscle aches, nausea, and fatigue. And you may notice that some of those side effects sound like the flu, but I do have to point out that the flu vaccine does not cause the flu. So while these symptoms mimic the flu, the vaccine itself does not cause the flu. So lastly, I'm going to leave you with some resources in case you have any more questions or you want some additional information about the flu and pregnancy. So first is the CDC website, and then the ACOG website, and then the March of Dimes website. And these are all really good websites that give really great information, and I will put links for all of those in the description box below. And lastly, you should always, always, always talk to your doctor if you have questions as well. So, your doctor should be your main source of information if you have questions about your symptoms or if you have questions about the flu vaccine. So, always talk to your doctor first. And then I would recommend for you to go back and take that test that you took in the beginning of the presentation. And that way it can be a little check on learning to see what you learned during the presentation. And I do hope that you learned something. And I hope that you enjoyed this presentation. Thank you.